Good morning, everyone. It's January 31st, and this is the second episode of Let's Talk US Healthcare. And on this video, we're going to go ahead and talk about how to read an insurance card. I love these cards. They're sent out at the beginning of the year, and they are just jam-packed with a lot of information that's really helpful to you. So you don't need to pick up the phone and call your healthcare insurance carrier, but you can simply look on your card. And I'm going to show you how to do that. So the first piece of information, and this is the very most important piece of information, is the member ID number. You'll normally see that right in the middle of the card. This could be alphanumeric, meaning is it could have letters. It could be a combination of letters and numbers. However, that particular set of numbers is what ties you to your insurance benefit and your insurance claims. Do know that that normally is a number that is consistent for every family member that's covered underneath the card. So in other words, if you have a husband or a son or a daughter that's on your insurance policy, you'll normally see that that number will be the same and everybody is covered underneath that number. On the right-hand side, you're going to see a set of number. Normally, you'll see a group number. That group number is basically tying your benefits, which we're going to talk about in a minute, so in other words, what covered benefits that you have to your member ID. So what that does is it basically says, these are the covered members and here's the covered services that are underneath that. Payer ID, that is just an assigned number that is assigned to whoever your health insurance carrier is, whether it's Blue Cross Blue Shield, whether it's Aetna, whoever's paying that claim for you. All right, let's go down to the really fun information that's down here, and let's talk a little bit about copays. So on this card, you'll see on the bottom, there is copay information, and you see that there is office copay of $25, an urgent copay of $50, and SPEC stands for specialist of $40. A copay is the amount of money that when you go in for services that they're going to ask up front. So in other words, I hurt my hand and I need to go see my primary care provider. They're going to say, okay, we're going to go ahead and see you, but I need to collect $25 from you. And I need to do that now, even before I file a claim. So if that provider refers me to, let's say, an orthopedist because I really hurt my hand, then that will be a specialist. And that specialist may turn around and say, okay, when you come in before I even see you, I need $40. So that is the amount of money that you need to pay up front. So that's what a copay means. Let's scoot down and take a look at the deductible. A deductible is the amount of money that you need to pay before your insurance benefits will kick in. So in other words, I go in and I hurt my hand, and I go in to see my doctor, my general practitioner, my PCP. I pay $25 copay, and then the rest of that money is going to go towards my deductible until my deductible is met. In this particular case, it's $500. So if I was to go in and I already met my $500 deductible, then my insurance will kick in. So in my particular case, I'm really fortunate to have good health insurance. When I go to see a PCP, it's covered at 90%. So if I go ahead and need to go ahead and see a PCP for my hand, and I already paid that $500 deductible, then let's say the visit is $100. My insurance company is going to turn around and pay $90 of that, and then I'll be responsible for $10 up until my out-of-pocket max. So let's talk about that. Over on the right-hand side here, you're going to see an out-of-pocket max of $2,000. So that says that when I pay my copays and I pay my deductibles, between paying all of that out of pocket, I am not going to pay any more than $2,000 in a given year. And that is what that copay max means, to where when I meet that, the insurance company will pick up 100% of the covered services beyond that point. So that is what that means. Let's flip the card over. On the back of the card, most insurance companies have got exactly the same type of information on the back of the card that has where you can contact them, so telephone numbers on how to contact them, where there are folks that are available to be able to talk about your benefits. A lot of them also have their website attached to it, and the website is super important because if you haven't been on them lately, it is so helpful to find providers and give you information about what is covered. Um, what is not on this particular card that normally I do see on most cards is also the pharmacy benefit information and contact information, as well as who to contact if you have behavioral health issues or mental health issues. A lot of insurance companies will put that number down as well. So I hope that you have found this helpful. Please go ahead and hit the like button and subscribe for our next episode, which will be next week on February 7th, where we're going to talk about how to make a hospital visit for your loved ones a bit more comfortable.